Hello, I'm Trisha Dowling, and I'm a professor of veterinary clinical pharmacology at the Western College of Veterinary Medicine. But I'm also a certified mindfulness teacher. And I'm going to give a little talk today about resilience for healthcare students. So the definition of resilience is simply the capacity to recover quickly from difficulties. Or, as I'd rather say it, how to land on your feet in difficult times and in stressful professions. So there's a lot of factors that go into this ability to bounce back from difficult circumstances. And so just some of the easy ones off the top. So physical health, right? We all know the importance of exercise, a good diet, and getting enough sleep, which is definitely a problem for most students in the healthcare sciences. And mental health has been getting a lot of attention in recent years. When it comes to resilience, we know that some people just have a natural predisposition for it. They tend to bounce back very quickly. But it doesn't mean that it's not something that you can improve. There's also a spiritual component to resilience, and this doesn't necessarily have anything to do with religion. This is just your natural way of finding meaning in your world, in your relationships, in your work. And then there's social supports. There's a good saying that none of us get through this alone. So again, this is an area where we can do some things to try to improve our social support networks. That's going to help us get through these difficult circumstances. So why try to develop resilience? Because you are entering very difficult professions. As I'm at the veterinary college, I know the most about our students, but the issues are relevant to all students. In 2003, student counseling carried out a survey and found that our students were really struggling with stress and depression. At the same time, I was finding mindfulness-based cognitive therapy for depression as a treatment for my own clinical depression. It was this survey and my own positive experience that made me pursue mindfulness teacher training and to develop a mindfulness course in the veterinary college curriculum. Because mindfulness was not well known in the veterinary world, much of my training was with medical doctors. And I had the privilege of training with an amazing group from the University of Rochester in New York. And they generously gave me their curriculum so that I could modify it for vet students. This group carried out studies on the medical doctors who took their mindfulness training and found significant increases in empathy and compassion. But when Dr. Krasner debriefed this study with us, he said, it's not like we made these doctors empathetic and compassionate de novo. We merely restored what had been lost through medical training. And he said this, we have to face up to the fact that our training programs hurt people. So that's why I knew I had to bring this training to the vet college curriculum. Because if as a faculty member I was part of the problem, then I also needed to be part of the solution. So definitely being a student is very stressful, but when you go into the healthcare professions, you're going to find out that practitioners are stressed as well. So I hate to tell you, the stress just doesn't simply go away when you graduate. You trade uncertainty about what is going to be on the exam for uncertainty of how best to treat your patients. Those student loans now have to be paid off. Your hours may get longer and you may have more on-call duties. So the stress doesn't go away, it just may change in what it looks like. So you may have heard the term wounded healer when it comes to healthcare professionals. The source of this term is from Greek mythology. Chiron was a centaur, half man, half horse, and the son of Zeus and a woman. So as the son of a god, he was immortal. One day, he and the other centaurs were hanging out, and Hercules came for a visit and brought some wine. Now, the centaurs weren't used to drinking, so they all quickly got drunk and started fighting. In the middle of the fight, Hercules let loose an arrow tipped with the poisonous blood of the Hydra, and it accidentally hit Chiron. But being immortal, Chiron was not going to die, but the wound never healed. While Chiron suffered from his wound, it was this suffering that drove him to search for relief, and that search brought him the knowledge, wisdom, and experience of healing. This enabled him to counsel, teach, and heal others, earning him the label of the wounded healer. The character Dr. House from the television series of that same name is an example of the archetype in modern pop culture. His physical and emotional scars are both a burden and a driving force in his need to fix the problems of others. Despite the popular jargon, medical care should neither be practitioner-centered nor client-patient-centered. The myth of Chiron allows us to examine the practitioner-client-patient relationship in a new way as a collaborative, participatory medicine. Mindfulness training makes it possible to look unflinchingly into what is most troubling and distressing and to simultaneously discover that is where the light enters you. Helping, if it's to be healing, requires practitioners to enter into the disruption, uncertainty, and chaos of identity of those seeking our care without losing ourselves and burning out. While these are the results from a veterinary survey, the results would be very similar to other healthcare professions. Notice the second question. So few of us actually ask for help. We tend to suffer in silence. The healthcare profession should take notice of the importance of wellness, if for no other reason than the economics of it all. Look how much time is lost from work. That range of 0 to 4,800 days, that's 10 years. 10 years not being able to do the profession that you've sacrificed so much for in your schooling and your training. So what are the consequences of this state known as burnout? At work, there's a loss of empathy and compassion for your clients and patients. We get sloppy, we make medical errors. We ultimately quit our profession despite the enormous cost that it took to train us. And we have poor relationships, again, with clients, patients, and colleagues. At home, this can be reflected in substance abuse, tendency to have auto accidents, a number of stress-related health problems. There's often marital and family stress, and there can be the consequence of self-harm. So what can we do about this burnout state? What's going on here? Well, there's a term that you may have heard of called compassion fatigue, and it's been very common to attribute this state of burnout to compassion fatigue. So here's the definition of compassion fatigue from a very popular website, that it's a state experienced by those helping people or animals in distress. It's an extreme state of tension and preoccupation with the suffering of those being helped to the degree that it can create a secondary traumatic stress for the helper. However, I believe that recent research from neuroscience has proven this to be a misnomer. It is not compassion that fatigues in healthcare professionals. It's actually empathy that fatigues. So, okay, terminology matters. What's the difference? When I first started exploring this area, I realized that I didn't know the difference between empathy and compassion, and I used them rather interchangeably. But here's the definition. Empathy is feeling with, vicariously sharing the same feeling with another. We can feel happy at the joy of others, and we can feel distress when we observe someone in physical or mental pain. While sharing positive emotions with others is certainly pleasant, the sharing of negative emotions can be difficult. The importance of empathy with your clients or patients has been long known. Sir William Alser famously said, "It's as important to know what kind of a man has the disease as it is to know what kind of a disease has the man." One of the leading researchers in this area is Dr. Tanya Singer. Using functional MRIs, she's been able to determine the location of these feelings in the brain. To determine empathy, she set up side-by-side functional MRIs and put married couples, who presumably liked each other, in them, and set up cameras so they could see and hear each other. Then the hand of the wife was pricked with a pin, and she'd say, "Ouch!" and her pain center would light up. But the exact same center would light up in the brain of her husband, just from seeing and hearing her expression of pain. Compassion goes beyond the feeling with the other to feeling for the other. Compassion is characterized by feelings of warmth, concern, and care for the other, as well as a strong motivation to improve the other's well-being. So in other work by Dr. Singer, she's been able to determine using the functional MRIs the location of compassion. So she put test subjects through trainings that either emphasized only empathy or ones that included compassion practices. As you can see, the empathy centers in blue, which overlap the pain centers, are different from the compassion centers in red. And the compassion centers are those in areas responsible for the release of oxytocin and dopamine. These are the neurotransmitters associated with love and well-being. So we know that pain is depleting, but love is not. So compassion does not fatigue. It's rejuvenating, and it's a skill, and it can be trained. So here's another way to think of the difference between empathy and compassion. We first have to start with empathy. I can't understand what it's like to be like you unless I know what it's like to be you. So if I'm in a situation involving the euthanasia of a patient, as a veterinarian, I've had to euthanize my own animals. So as I counsel a client, I know what it feels like to be in that situation. The danger lies in following along the lower pathway. If I start taking on the client's feelings and reliving my own distress over the loss of my own animals, I get into the state of empathetic distress. From here, I can easily get overwhelmed and start to focus on my own feelings. If I let this continue to happen, I become emotionally depleted and suffer from burnout. As a last-ditch effort to protect myself, I may withdraw from my client. I can become cold and distant in order to protect myself. And I'm unable to be present at a time when a client needs me the most. However, if I understand that I can lift my response to the higher pathway, I can turn on compassion. I feel your pain and I wish you not to have it. So instead of focusing on myself, I'm projecting concern and sympathy to the client. This promotes my own good health and motivates pro-social behavior. Practicing compassion is rejuvenating. If you like to listen to podcasts, this is a great one from Radiolab. As they investigated the characteristics of people who risk their lives for others, they recognized that it is the compassionate people who spring to action, not the empathetic ones. The empathetic person may see you in trouble, say getting physically attacked, but their empathetic distress makes them turn away from the situation. The compassionate person thinks, I feel your pain, I wish you not to have it, and jumps in to help. This is a photo from a collection by a photographer who embedded himself in with veterinarians performing euthanasia on pets. It's a bit tough to look at it, but it illustrates what I've been saying. You can absolutely see the great pain and grief on the face of the woman whose dog has just been euthanized. But look at the veterinarian. Her face shows care and concern, and she's reaching out to comfort the client. To be able to do this, to do our jobs with care and concern for our patients and clients, we need to be resilient, and compassion training is an effective support of our resilience. So compassion is definitely a skill, and it can be trained. So compassion training is a big part of the mindfulness trainings, and there are a lot of studies proving just how effective it is. This is an interesting one that involves the redistribution of wealth. After compassion training, participants are more likely to be altruistic in sharing wealth. But what about self-compassion? You have probably heard the term imposter syndrome, that feeling that everyone is smarter than you are and you don't deserve to be in your program. Typically, you get lots of advice that you're just as good as your classmates, but often imposter syndrome still impacts many students. So what's the antidote? It's self-compassion. We healthcare professionals are often good at showing empathy and compassion for everyone but ourselves. So where does imposter syndrome come from? Well, it comes from your inner critic. That's the little voice in your head that comments and passes judgment on everything you say or do. And we all have one, and we don't realize that everyone else has one. So why do we all have an inner critic? Well, if we all have something, it must be evolutionary. So the purpose of the inner critic is to keep you safe. When you were a baby, you couldn't really communicate with your caregivers, but it was very important that your family like you or they'd leave you for the wolves. So even before you could talk, you started taking in the family norms. If you do that, mommy smiles. If you do that, daddy gets mad. Even as you grow, the inner critic tries to protect you. Don't speak out in class, you'll get reprimanded. Don't act like that or you won't have any friends. So by the time you hit adolescence, you pretty much know all the social rules you need to fit in, and the job of the inner critic is done. But no one ever tells you that, so you keep going with this annoying little voice in your head judging everything that you do, and no one has ever told you that you can tell it to shut the hell up. So this might be a good place to hit the pause button and close your eyes and reflect on that little voice in your head. Describe it to yourself in great detail. Who or what does it look like? How do they sound? What do they usually tell you? So as you do this reflection, you may notice that the voice of the inner critic belongs to someone you're related to. Could be a parent, somebody who is an authority figure, could be a teacher, could be a coach. What kinds of things do they say? Usually, you're not good enough. You should have done better. You should have studied harder. You're lazy. You're never on time for things. Those kinds of things. Lots of it is very, very negative. Now, for me, my inner critic is kind of an amalgamation, I think, of many different people. So it's easiest for me to best visualize my inner critic as this, a yappy little dog. So what helps here is when you give your inner critic a persona, then you can start to have some fun with it. For me, when the yappy little dog is going on and on about, oh, you think you're so smart and, your students really don't like you and no one will ever like you and you will die alone, whatever it's saying, I can sit there and go, shut up, because it's just an imaginary yappy little dog. You can do things like agree with your inner critic. That one works really well when I have the voice telling me, you're the worst mom ever. Oh, I'm the worst mom. I'm number one. I'm number one. Right? Now, don't try to argue with your inner critic because it'll always get the last word. So maybe it's saying, your students don't like you very much. Well, hey, I got really good evaluations last term. And then it'll go, ooh, who do you think you are? You're getting so big for your britches now. So don't argue with your inner critic. Now, if this kind of information is somewhat appealing to you and you'd like to learn more about it, I can certainly suggest some information from my own teacher. This is Dr. Mark Coleman, and he is a mindfulness meditation teacher. He's one of the people I took my training with, and he wrote this lovely book called Make Peace with Your Mind. He also has a lot of free online seminars and such on this particular subject. So he is very, very good at helping you work with your own inner critic. Another person who has been really instrumental in this world of self-compassion is Dr. Kristen Neff. And she is a psychologist at the University of Texas at Austin. And she's really been the leading researcher in this world of self-compassion. So she has the studies that back up how effective this is. So she looks at the three elements of self-compassion, giving ourselves self-kindness instead of that inner critic self-judgment. Recognizing that we all suffer, that we all have these feelings, rather than thinking we're the only one who ever feels like this. The mindfulness piece is being able to just sit with thoughts that come up and not taking them on, not believing at everything that that little inner critic says is true. So her research indicates that people who are self-compassionate demonstrate better psychological health than those who lack self-compassion. Greater self-compassion predicts lower levels of anxiety and depression, which may be related to the finding that self-compassion tends to decrease cortisol and increase heart rate variability, which is associated with the ability to self-soothe when stressed. Greater self-compassion is also linked with less rumination, perfectionism, and fear of failure. Self-compassionate people are less likely to suppress unwanted thoughts and are more willing to acknowledge their negative emotions as valid and important. Self-compassion is associated with positive psychological strengths such as happiness, optimism, wisdom, curiosity and exploration, personal initiative, and emotional intelligence. Being self-compassionate improves our ability to cope effectively with life stressors such as academic failure, divorce, childhood mistreatment, or chronic pain. Self-compassionate individuals function better in relationships and report more empathetic concern, altruism, perspective-taking, and forgiveness. Self-compassion also promotes health-related behaviors such as sticking to diets, reducing smoking, seeking medical treatment when needed, and exercising. One of the strongest barriers to self-compassion is the belief that self-compassion is self-indulgent or that it will undermine professional motivation, that you won't succeed unless you're beating yourself mentally with a stick. This is simply not true. Dr. Neff's research demonstrates that self-compassion is associated with intrinsic motivation and greater personal initiative to make needed changes in your life. Because self-compassionate people do not berate themselves when they fail, they're less afraid of failure and more able to take on new challenges. So if you take these trainings to heart, just maybe you'll be able to deal with your own inner critic. So as you embark on your career in a healthcare profession, I'd like you to answer this little question for yourself. What's the difference between illness and wellness? Well, it's kind of pithy, but we say there's an I in illness and there's a we in wellness. And no one gets through this alone. So as we end here, I'd like you to think about resiliency in your relationships. And try this little exercise. Identify 3 people who you consider safe to talk about stressful things with. Write their names down on a piece of paper and put it in your wallet. Let them know they are on your list. Try to include a family member, a friend, and/or a colleague on your list. And call as needed, but call one of them tonight and tell them how much you appreciate their support. So in the mindfulness business, we talk about a concept called Indra's net. And that's the understanding that you are part of the universe and you deserve no less love and care than any other being in the universe. And Indra's net is represented by a spider's web with drops of dew on it. You look at the myriad of connections, and at each connection point, there's a drop of dew reflecting back all the other connections. So stay connected, practice your compassion skills, and good luck in your healthcare profession careers. And if I can ever be of assistance, this is my email address, and feel free to contact me.